Hello and welcome to another hair transplant video. So this one is actually a little bit over a 1 month update on my hair transplant procedure that I got done at HQ Hair Transplants in Cardiff. I'm 23 years old and I had an FUE procedure, roughly 2,200 grafts, and I'm going to take you through my first PRP injection plus a 1 month update. So what I'll do is I'll show you what it's looking like at the moment. Currently, we are exactly a month and 9 days after my surgery. So the PRP video was filmed a couple days ago and I just wanted to take you through that. If you want your free consultation with HQ Hair Transplants, just contact them. You can go over to their website, which will be the link in the description. So will their Instagram, and you can just mention my name during the free consultation and you'll get £300 off of your procedure. I'll put a little bit of a background on the actual procedure itself, which went amazing. So I went into HQ Hair Transplants clinic in Cardiff, which we had it all arranged online to book my PRP injection. This is my first one out of 5 and it's been over a month post-transplant. I think it was a month and a couple days after my transplant, and I walk inside, got greeted, got offered a coffee as usual. The team there are absolutely fantastic. And then I met the nurse who was going to do my PRP injection because Dr. Rahman, my surgeon, was in the middle of a surgery, but the nurse was absolutely fantastic. She did the procedure amazingly. And she was very, very kind and also very knowledgeable. I asked a load of questions and I'm sure she was getting a bit annoyed, but she answered all of them for me, just gave me a bit more insight onto what I was getting into, what I was doing. And it's always nice just to know a bit more, right? So first thing is I get nice and comfortable on the chair and my blood was pulled out of my arm, my left arm. Painless, there was no pain whatsoever. I think a lot of people get scared of needles going in and out, whatever the case is. But as I've said to you guys, I think one thing that makes HQ Hair Transplants special compared to others is they really take into consideration how you feel in general. They don't just speed up the process, make it as quick as possible, get you in and out. They do take their time and they ask you how you're feeling and they take it nice and slow and make it pain-free. So blood was taken out and then I was explained that it was going to get taken to the centrifuge, which takes around 10 minutes, which essentially spins the blood round in a big centrifuge, I don't know how else to word it, which I believe separates the plasma and the blood itself, because your blood is a mixture of a bunch of other things and the plasma is what contains most of the nutrients that you want to inject directly into your head. And then it was mixed, I believe, with some sort of mesotherapy. I'm not sure if I'm wording this correctly, which essentially is other minerals and nutrients to give my head lots of good things to go inside to help speed up the healing process and the hair growth process. So after that, I was just sitting there watching TV, just like my hair transplant surgery. It brought me flashbacks into how it was feeling. It was really nice being back, to be honest with you. Just seeing the team there, they're all so friendly. And the nurse came back in and essentially showed me everything, explained how it was going to work, where at first she offered me if I wanted numbing cream on my head, which takes a little bit of time to set in. And, you know, it's not going to make a massive difference. I know I'm already okay with the needles after the first hair transplant surgery, the first time I came in, where I really didn't feel anything anyway, but obviously did have local anesthetic when I was getting the hair transplant done. But still, I didn't feel the first initial local anesthetic going into the back of my head, which a lot of people are very, very scared of, and they say it's the most painful aspect of it. But they use like this little vibrator tool where they place it on your head and then they do the injection, which essentially like tricks the brain into not actually feeling it because it's distracted by the vibrations, if that makes sense. Really, really smart. And then that's where the nurse explained to me, do I want the numbing cream or do I not? I said I don't want it because I didn't want to wait. I wanted just to get it done, chat to the team, and then speak to Dr. Rahman. So I went without the numbing cream, and she also explained how she was going to use a little vibrator tool while she did it. I might feel a little bit of a pinch, which I didn't. I really didn't feel anything. As always, sat there relaxed. You probably see in the video I got my eyes closed in a portion of it, just speaking to the nurse. She was from South Africa, absolutely lovely individual. Just makes it a lot nicer when you can actually speak to the people doing your procedures, whether that's a hair transplant or the PRP injections. And then had multiple tubes of the PRP, and that was injected directly into my head, where I was given the choice of where I want it directly, and I said I just want it in the hair transplant regions because I'm not really balding anywhere else, maybe a tinsy bit in the crown, but I just said, yeah, just do it around the hair transplant procedures, which that's exactly what was done. Lasted maybe 10 minutes, if that. No itching, no swelling afterwards. Maybe there was slight bumps on my forehead from the actual injections itself because there's liquid going inside, but that faded within half an hour, an hour. As soon as I left the clinic, went and got some food, it was gone. I didn't even really realize. I forgot I had the injection done, but I was advised afterwards not to wear a hat, which I did, unfortunately, because I was out in Cardiff and I had a couple flat viewings and it was very, very sunny outside. So I just wear my hat on very loosely. But what I did is I bought this hat that I'm wearing now directly in the store. It was like a brand new packaged one. So I knew it was going to be clean, relatively sanitized. So the likelihood of me getting some sort of infection was very low because it was a new hat. It wasn't one that I've been using before that I've sweated in or whatever the case is. And yeah, that's pretty much it. Preparing the injections, centrifuge, putting in the injections themselves, lasted maybe 20-25 minutes, if that, pain-free, and now hopefully it will speed up the process of my hair transplant, or who knows what it will do, but I know there's lots of benefits in terms of hair strength, hair regeneration, hair growth, just the overall nutrient and mineral profile going towards your scalp, which will in turn promote blood flow as well, because you're doing little micro needle injections, which does promote more blood flow, which essentially also sends more nutrients towards your scalp, which is what you want for nice, dense hair. So now that I've gone over that, hopefully I haven't missed anything. I'll show you what it's looking like right now. So we are 1 month, 9 days after the hair transplant surgery. Really happy with how things are going. I'm currently just finishing up the shedding phase, really. So you'll be able to see what my hair looks like without the hair transplant. It's pretty atrocious, I'll tell you that much. But wearing a hat just at the start of the video. So as you can see, this is what it is looking like. That's where I had the hair transplant done. I've going through the shedding phase. As you can see, I was balding quite a lot, okay? And they've all fallen out. So if you would have noticed in the first couple videos, I had it like there, and there were small little hairs all going around. You can kind of see it now. You can't, okay? This is what the back is looking like. So where the actual hairs were taken out is healed up completely. There is no pain, nothing whatsoever. You can't even tell at this point. I go get my hair cut maybe every week and a half, every 2 weeks, and don't feel anything, right? Except for the tops and the parts here. I don't use like one of those razors, right? It's only allowed to be scissor cut. Right now, I'm not even touching it. But yeah, it's a slow process. And I spoke with Dr. Rahman, who will go over like what I should expect in the next couple months. There'll be an interview with him right after this segment of the video, just to give you guys a bit more insight, give myself a bit more insight. But we should be seeing a bit of hair start growing within the next sort of month or so. I'll maybe start seeing small little sprouts, but realistically at that 100-day mark, which will be another good 2 months, right? Which I'm okay waiting for. And then 3 to 6 months, I should start getting a bit of hair, and then 6 to 12 months is that real rapid hair growth phase, which I am excited for because I'm fed up of being bloody bald. I do sometimes miss my long hair, but the question is, do I regret getting a surgery? Do I wish I waited longer? Do I wish I got more grafts, less grafts? And the answer is no, 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 no. I am completely happy with everything, and I would not change a single aspect of it. The recovery process has been amazing. I'm beyond happy with the hairline that was created because, as I mentioned in the original video, the doctor really listened to me and made sure that I wasn't going to regret my choice as well, but whilst also making my perfect hairline. And, you know, 2,200 grafts. I've got plenty of grafts left over if I needed to ever go back for my crown, the center. I've got lots left, okay? So that's a fantastic part. Don't fall for the trap of people saying you've got 5,000 grafts in one single aspect of the front of your forehead, because anything really over 5,000 grafts coming out the back of your head, you'll start to notice, okay? So yeah, that's gonna cover the first part of the video. Next, you will see an interview with myself and Dr. Rahman, so enjoy that. And that will end after. I will catch you guys when I do my sort of 2-3 month follow-up. So hopefully we should start seeing a bit of a difference there, but very exciting times. What I will end this part off as well is if you want your free consultation with HQ Hair Transplants, just contact them. You can go over to their website, which will be the link in the description, so will their Instagram, and you can just mention my name during the free consultation and you'll get £300 off of your procedure. As well as that, I think a really fantastic thing that they offer is 0% interest finance for the procedure, because a lot of people don't want to pay a large lump sum, which is completely reasonable, but this just makes it more appropriate for people essentially, because you've got different ways to pay, so why not? Any questions, leave them in the comments below. Hopefully you enjoyed the rest of the video, and I'll catch you for the next one. Right, so I am at HQ Hair Transplants, and as you've seen, I just had my PRP injection and mesotherapy. Yeah. Absolutely fine. I didn't even have any numbing cream. Yet again, I think a lot of people have the expectation that the hair transplant is going to be painful, PRP is going to be painful. I didn't have any numbing cream just now. It was absolutely fine. Like the pain is pretty much zero for me. I don't know if I'm just a one-off or anything, but absolutely fine. Lasted around 10 minutes, if that. Just get your blood drawn, and then injections in the head. But I'm going to pass it over to Dr. Rahman, who did my hair transplant surgery, and he'll just give you a quick explanation on what I actually have done just now.
Hi, Mikey. Thank you for coming back.
Of course.
So PRP you asked about. So PRP, platelet-rich plasma. So what that is, it's been around since 2011 for hair transplant, and it's used in a lot of sort of settings. People can inject into their bones, tendons. It helps with the body's recovery everywhere. In particular with the hair, so it has a lot of growth factors, numerous one, like vascular endothelial growth factor. I can name a few, but it won't make sense. And what that does is basically encourages hair growth. And so it has a double effect. So one is the PRP, the plasma itself, which has the growth factor concentrated. That helps with the hair growth. The other thing is when you inject, the needles causes micro trauma, and that causes increased blood supply to the scalp. So it sort of has a double effect. Yeah. So it's micro needling and PRP.
I didn't think that.
Yeah. So yeah, it's quite good. There's a lot of proof that it works. And usually the most recommended sort of regime is that you do one a month for 3 months, and then you do maintenance sort of 6 to 12 months, depending how you respond. So now you are 1 month, so just over 5 weeks. So you might still have few hair to shed. Some of it might not shed at all. So we will see you again in September, which will be at 3 months. So just before that 100 days sort of turning point. By then, we only expect 5 to 10% of growth. The main point of that meeting is to give you reassurance, because a lot of people start panicking at 2, 3, 4 months. It's like, it's not growing, what's happening? So at 3 months, you won't have much growth. But then as soon as it passes sort of 3.5, 4 months, it will start accelerating. And the sort of the speed will peak at around 5, 6 months. So at 5, 6 months, you'll still have 40 to 50%, but the rate at which you are seeing new hair will shoot up. Yeah.
Perfect. So by Christmas time, I should.
Yeah, by Christmas time would be 6 months, right?
6 months.
Yeah, you should have a good hairline. Still more to come, obviously, but you should have something to work with.
Yeah. Perfect. So one thing as well that I have also been doing since before the hair transplant, but I've carried on afterwards, was the finasteride and minoxidil. So that's one thing that I've been taking on a daily, just to act as a preventative, but then also support the hair transplant itself. Is that something you recommend for people to take after hair transplant? Because a lot of people think they have the hair transplant and they need to stop, they don't need to care anymore about their hair. What's your thoughts on that?
So medical stabilization, be it finasteride, minoxidil, PRP, or even something called low-level laser therapy. This all helps to stabilize your hair fall. You need to remember that the hair fall or androgenic alopecia is progressive. So if you fix the front, you might still continue to lose the back. So to slow down this or even stop it, you need some sort of medical stabilization, minoxidil, finasteride, and the other things we mentioned.
Yeah.
So hair transplant fixes where the balding is, but your hair fall is not fixed by hair transplant. Your hair fall needs to be fixed by medical therapies.
And then I just wanted to give you guys a very quick roundup in terms of how the first month has been. I mean, is really, really good. I've been using things like hair fibers here and there, which definitely help boost confidence. But the one thing is I've luckily had the support of Dr. Rahman, where I literally message him and he replies to me on the day, which has been incredible and really, really nice and really reassuring as well. So things like that I've tried out. It was fantastic. I felt supported throughout the whole journey. So I haven't had one moment where I panicked, except for when I hit my head. I hit my head on a microwave, and I was like, oh my God, oh no. And then we sent some photos over. We had a look. It's like, it's not bad at all. There's maybe one graft loss, if any, right? Because it wasn't too bad. And that was really nice, because I was panicking, and I messaged at like 9 p.m. and Dr. Rahman still replied back. So that was amazing. And now the shedding phase this is the ugly duckling phase before everything starts going back, but it's the exciting part. And, it's been it's been completely painless for me. It's been back to training now, which has been very, very nice. And the hardest part was just staying home for 2 weeks, not doing much. And it's just all a part of the process. How important would you say the actual initial phase of, I'm not sure what the word is, the initial looking after the hair after the hand transplant is for the success of it?
It is very important, especially the first sort of 48 to 72 hours, because the grafts are there still fresh, still not fully anchored. It takes 9-10 days for it to be fully anchored, but the first 24 to sort of 48 to 72 hours is very fragile. So in that phase, you need to strictly follow the aftercare instructions, including keeping it moist, not bending down, sleeping sort of propped up, and making sure nothing touches the grafts.
Microwaves especially.
Yeah, I think that happened a week after, isn't it?
A week after,
yeah, so that's not too bad. That's not too bad. If that had happened in the first 24 to 48 hours, you would have lost hundreds of grafts. But because it happened a week ago, maybe 1 or 2, which is not too bad.
Yeah, and it looked like it's completely healed now. You can't even tell. So that's really, really nice. And cool. Right. I had a lot of people as well comment on my sort of TikToks. I've been making YouTube videos saying, how many grafts have you had, right? I had 2,200, I believe. And I think a lot of the time, all over the internet, you see people get 5,000 grafts, 6,000 grafts, and it's pretty much the exact same area I've had. However, that leads to one specific problem, right? In terms of if you ever needed another one, you've got, you're going to be able to tell in the back of your head. And what are your stances on, do you think a lot of people advertise that they give you this many grafts to make the person feel like they're going to have the best hairline ever? But realistically, if I had 4,000 done in the same area versus what I've had now, is there much of a difference? How does it affect it? And obviously it gives me the opportunity, if I ever needed any done at the back or anything, I've got the chance to do that now.
Yeah, there's no need to put in too many hair where you don't need to. There's something called a coverage value or something. So there's one guy who did a study where he basically took a bit of hair and then asked people, does this person have hair loss? Only at sort of when you took half of the hair out, then you could tell that you have a hair loss. But so we need to only get into that halfway point. We don't have to get you 100%.
There's no point otherwise.
There's no point. You're just adding extra grafts for, something that people won't notice. And it's not sort of possible to get you natural density anyway. Of course not, with your natural hair, there's probably maybe 8,000-9,000 follicles there, and it's not possible for us to cover that, because the maximum that's recommended per centimeter square is between 50 and 60 to give you good density at the hairline. Anything beyond that, you're at risk of something called necrosis. So what that does is tissue death at the site. So because you're giving so many incisions, you're having blood loss there, you're disturbing the blood supply there. So you can't have it too dense, then you're at risk of that. And at the same time, you don't need it as dense as you can. Some people put as much grafts in as small area as possible. And also that affects the survival, because you're creating so many slits that there's so much trauma. That area is so deprived of oxygen that your follicles are not getting the oxygen it needs, and it dies off. And the thing you mentioned about the future, as I said, hair loss is progressive. If you put 5,000 grafts here and then in the future you lose the mid scalp or the crown, then you don't have anything to cover it with. It's every person is different, and until you start extracting, you don't know for sure how many you can take. You're generally safe within the first procedure, but then when it comes to second or third, you need to be very careful.
Yeah. Last thing that I wanted to finish off is people sometimes, I had the opportunity to keep my hair, right? It was either I could keep the fringe or shave it off. I wanted to shave it off just for the full experience, but that is one thing Dr. Rahman told me he does recommend me doing it. And I'm so glad I did it because I realized my balding was way worse than I actually thought. My fringe was covering it really, really well because I grew it out very long, but then I've got that one massive gap on the right side. I always thought, why isn't one side as dense as the other? And it all makes sense now. So I think without doing things like that as well, not treating it like the full procedure, you might not be able to spot that actually you're losing a lot of density here. We might need to add some hairs there. So I always call it the Batman logo, but you've noticed I'm so glad that I did that because these two parts were one of my main problem areas, and now it's fine. So
yeah, we can't do it without being shaved, especially if you need sort of 2,000 grafts. Then we can sort of not fully shave. They still take out enough grafts to put at the front, but we generally recommend that you shave.
Yeah.
Because then we can really get into the middle of the other existing hair, start blend in the hair, and also cover the balding areas, as well as give you some sort of blending in. So just in case in the future you lose some of your native hair, you have some hair there, rather than having a funny shape where you have hair, nothing here.
No, you see some horrible ones out there.
Yeah.
No. Perfect. Well, that is my 1 month update. Not long left now. It's all a part of the process. And am I happy I got it done? Of course I am. Everyone knows that. So on that note, thank you very much, Dr. Rahman. I'll be seeing him very, very shortly, and I'll catch you soon.